For me, it's been great to be back here at Cosmetic Surgery Forum. I'm enjoying being in Nashville, and at this year's meeting I spoke about fillers, I spoke about laser resurfacing, and I spoke about topical skincare with the new estrogen-deficient skin product by Biopel called Emipel. So, first of all, from a filler perspective, I think we all have our little tips and tricks that we like to do in terms of some of the things that we incorporate into our regular practice and some of the things that help us give great results. So I enjoy sharing the podium with some colleagues and friends and seeing what they do, and then really just talking about some of the different techniques that we have. And one of the things that I've incorporated in the talk is to really show something that I might consider to be a little nuance that I do in my office, and then show some of the data or some of the anatomy behind that. And I think that that's really helpful from a practical perspective. In terms of resurfacing, there's a lot of times where I'll use a combination of devices on the same day, and I think it's really helpful to have at your portfolio several different things that can treat skin from lines and wrinkles with resurfacing, and very often ablative resurfacing, to discoloration such as a Q-switch laser or BBL type of procedure for pigment, and then treating something with a 1064 or a pulse dye laser. So I spoke about the Jewel and the Jewel platform really having the ability to use multiple different wavelengths, multiple different articulated areas to really help the patient in front of you be treated without pulling out from a 220 plug and pulling in multiple different procedures and lasers that have to calibrate. So that one plug philosophy. And then from a topical skincare perspective, I think we're learning a lot about some of the changes that happen in menopause and some of the challenging patients that we actually see whose skin is really going through an accelerated change as they get into their later 40s and early 50s. And some of the studies and statistics that show that women actually lose 30% of their collagen in the first 5 years after menopause. So being able to intervene with procedures is something that we have a cornucopia of many things that we can do for them, but being able to integrate new and innovative skincare like Emipel for estrogen deficient skin, which actually is an estrogen receptor activator. It's not estrogen, and once it activates that estrogen receptor in the skin, it becomes a completely inactive metabolite. So in terms of the bloodstream and anything, there's just inactive metabolite that's seen subsequently in some of the studies that were done. So Zoe Dralos published a study last year that was a safety study which included serum levels of patients at 6 weeks and at 12 weeks and found to just have this inactive metabolite. In addition, there was a subset study that was part of her project that really looked at what happens to those estrogen receptors. And in the presence of estrogen receptor activator Emipel, there actually is an upregulation of those receptors. So that tells us that people have an ability to respond that's innate, and then they have an ability that can actually be upregulated to respond. And that was something that we saw in the clinical trial that I am publishing in JDD December 2019 issue that really looked at an open label project that I did at my office that was an experience trial of 20 patients, and some patients had very quick improvement that you could see at 8 weeks, and some people it was a little bit longer. But there were some patients that by 20 weeks they had a very significant response where the response was kind of slow at the beginning, and it's really thought that it's probably part of this process that the longer somebody's been in menopause, the harder it is for them to really upregulate those receptors, but eventually those receptors do get upregulated and people have an ability to respond and can respond very significantly. So I like to use this product in conjunction with some of the procedures I'm doing, and there's a day serum which is 1% MEP, and then there's a night cream which is 2% MEP. And the day serum really layers on nicely, it's not tacky, you can put sunscreen over it, and the night cream actually has a retinoid in it, so there's some moisturizers in that as well. So this has been a really wonderful meeting, and it's great that DermTube is here to do meeting coverage. Thanks for joining us.